Hello, it's Dr. Rhonda Johnson, and today is Tuesday, March 18th, 2022. And today, in honor of International Women's Day, I am discussing the COVID-19 pandemic's impact on women. Well, first, globally, COVID outcomes differ by gender. Global data shows that more women than men get tested for COVID-19. More women than men have received 2 doses of the COVID-19 vaccines. Now, men and women are roughly equal when it comes to the number of confirmed cases, but men have a higher proportion of hospitalizations, ICU admissions, and deaths. Now, this global trend for higher hospitalizations and deaths for men is also seen here in the United States. Now, as of today, there have been 449 million plus COVID infections around the world. That's almost 500 million people who have been infected with COVID and over 6 million deaths. So this amounts to a lot of women who have had COVID-19 worldwide. Why is that important? Well, let's take a look at long COVID. Unfortunately, medical experts haven't established a standard definition of long COVID, and only 2 countries report long COVID outcomes, the UK and Sweden. But in these 2 countries, it is shown that more women have long COVID than men. Now, here in the United States, estimates vary, but some estimates say that women are more than 4 times likely to have long COVID than men. So in summary, men and women have an equal risk of COVID because the virus does not discriminate or have a preference. But women are more likely to get tested, less likely to be hospitalized, more likely to have completed their primary vaccine series, and women are more likely to have long COVID. So why are there these gender differences in COVID outcomes? Well, a number of factors are at work, including biological differences, differences in the immune response, differences in attitudes, behavior, and the unique circumstances socially of women. Women have been really hit hard by COVID-19. The United Nations predicts that women will be in poverty, more women and girls. The pandemic will push 47 million more women and girls into poverty. There have been at least 7 million additional unintended pregnancies, and sadly, partner violence against women has risen in many countries around the world. So in closing on this International Women's Day, there needs to be an increased awareness on how this pandemic has impacted women, not just in terms of their physical health and well-being, but socioeconomically also. My views are my own.